there are lots of barriers. There's lots of reasons why not to change that I've heard over the decade. Not cost effective, no business case, not enough evidence. And I believe in all of that, but while we sort through evidence, while we figure out the business case, why aren't we implementing standards and changes immediately to prevent future harm to patients? It's estimated, I think conservatively, that there were, this was an estimation that was made a while ago, but it may have increased since then, that there were 100 kids a year suffering from kernicterus as we built our program. So that's almost a decade worth of injury to newborns as we compiled enough evidence and implemented change. You know, a reporter said to me, how was it that PIC changed the standard of care so very quickly? And I was kind of speechless because 9 years is not quick. So I'm going to challenge you all. Remember the CEO from Texas, from HCA, he changed in a week. Others have stepped up and been very courageous, and I think that's something that is lacking in our healthcare system, is courage. It takes a lot of courage and passion and partnership to drive change. Another example of patient engagement and raising awareness and driving change is Consumers Advancing Patient Safety, an organization that Marty and I founded about 8 years ago. And we based it very much on the model of PIC. And we have, oh, here's our vision, is creating a global healthcare system in partnership with providers that is safe, compassionate, and just. We have partnered with AHRQ. Probably one thing that we believe in strongly is that patients should be able to report patient safety events and bad outcomes. Right now, there is no mechanism to capture that wisdom and those numbers. And so CAPS has also partnered with the World Health Organization. We've done workshops with patients and other stakeholders all over the country. And so we believe that this partnership with patients will drive change. One project that we did was with a community. So this can be an international, also be community, in that we had a initiative with Aurora Healthcare to improve medication safety with their seniors, or medication reconciliation. So they brought the consumers to the table, people over 55, they call them seniors, and healthcare providers. And they created a patient safety advisory council for the community, and they came up with the design of a bag with a medication list that was consumer created, with posters, with advertisement, and it improved their medication, the accuracy of their medication list almost by 20%. That saves lives. And so I wanted to share that, what CAPS has done. I also want to share with you the WHO Patient Safety Program that Marty referenced. They have, when they started this over 8 years ago, there was pushback, but Sir Liam Donaldson, who is the lead of this, really wanted patients at the table. So he invited me to lead the Patients for Patient Safety, where we recruited patients from all over the world to join us in our network. And we have we sat with Atul Gawande when he created his checklist. We surveyed patients globally what they thought about checklists. They like checklists. We understand checklists. We want to help you implement checklists. We want to demand checklists. We feel safer when there's checklists. Another thing that we did with WHO was hand hygiene. And we put out a survey asking patients would they ask their provider to wash his or her hands. Of course, no, we asked them first if they want to be involved in their own safety. 86% said absolutely, from 59 countries. Then we asked if they'd ask their healthcare provider to wash his or her hands, and the percentage went way down. You know, no, not really. Why? Because they feared that it would compromise their healthcare. So we didn't stop there. We said, what do you need? Because we need you. You know, we need you in this effort. So what do you need to ask your clinicians to wash his or her hands? And the answer was very simple. It was an invitation. We want permission. What an easy concept. The WHO thought that was monumental. But are you inviting your patients into participating in their health care? Are you giving them that permission? I think that's something that's lacking. It sounds like an easy thing to implement. The culture has to be one to be receptive to that, but I think this could help reduce hospital-acquired infections.